Hey, I'm Dr. Brian McKay at Core Health in Darien, and I'd like to talk to you today about headaches, migraine headaches, neck pain. So, neck pain, headaches, and migraine headaches um, are the topic I want to address today. Now, the one thing people don't realize is, you know, headaches seem to be very, very common. People could get them, and a lot of it's related to structural issues in the neck or in the base of your skull, where the kind of if you just rub your hand along the back of your neck, back of your head where it meets the neck, and that's the suboccipital area. And chiropractic care does a wonderful job with headaches, and it's the type of thing that people just are so in tune with popping a medication and having that as their primary way of dealing with a headache. But over a long period of time, you're not really going to solve the underlying problem, meaning that where it's coming from. I mean, you go ask a medical doctor, he just says, "Hey, take some Advil, take some Aleve, or go get Botox injections." Botox injections, if you don't have insurance coverage, are $5,000 a month. Let me tell you something: chiropractic care can do a heck of a lot better job without introducing toxins into your body, which is basically what Botox is, botulinum toxins. So it's a much more natural way by taking pressure off the cervical spine. And the one thing people don't realize is that you will sleep so much better when you do not have tension on the neck. I mean, the neck tension really keeps people up a lot. You're tossing, you're turning. Um, it makes it really difficult for you to get a good night's sleep as a result. So a lot of times you have neck soreness. I mean, if you have someone, listen, take your right hand, grab the left side of your shoulder, press. You can have a lot of tension there. I mean, these days, people are on their phones constantly with text neck. Um, Now, with this COVID virus, people are working from home, sitting at desks that aren't really ergonomically set up. So there's a lot of tension. But also, I would say, hands down, people are on the phones way, way too many times, much too much time during the day, and as a result, you crane your neck, and for every little bit forward translation of the neck, you're going to put a lot more pressure on the spinal column itself. So basically, what we look for as a chiropractor is the big term is called subluxation. That's where the bones misalign, but the bones of the neck misalign quite easily because of these stresses that we're putting on. You're leaning forward, you know, people craning their necks to see their phones, um, and also working at PCs all day long. So you really have these issues, and you'd be surprised at how simple it is, the chiropractic adjustment to identify where the subluxation exists and how to go about correcting it. And the amount of tension you can get out of is phenomenal. People are in so much agony with headaches, and chiropractors, unfortunately, are the last people to get, hey, listen, maybe go see a chiropractor if you're having headaches. Um, you know, you have to do some physical therapy along with it. I mean, this tissue that you have to address, but you really, for the most part, the chiropractic adjustment in and of itself is really going to lick most of the issues you're going to have with with headaches. I mean, granted, not every headache is going to respond to the chiropractic adjustment. That'd be just fallacy, but a fair number do if only you were to seek it out. And what ends up happening is, your doctor's not going to say, "Hey, go see a chiropractor for headaches." I mean, they might, but for the most part, I doubt it. So it's kind of up to you. I mean, and specifically the type of headaches, migraine headaches, cervicogenic, which means it comes from the neck, and tension headaches really do a great job. I mean, that's why people go for massages. I mean, I think that, but the massage is not going to correct the subluxation. So if those bones are twisted out of place, you need to put them back in place and take tension off, because right at the base of your skull is the brain stem. So can you imagine having pressure on your brainstem, what that can do to upset the apple cart in your body? It can have an awful lot of deleterious effects. But lack of sleep is one thing. When you can't get comfortable to go to sleep, you're going to have some serious problems, and that's something we need to address. And you know, I'm not talking about like copious amounts of care. We're talking about a fair amount of care to one. You have to assess, diagnose, and manage the subluxations. You know, it can be a really, really beneficial way, to deal with it. Now, people think, a headache versus what's the difference between a headache and a migraine? Okay, to me, people with bad headaches have migraines. Now that doesn't sound really scientific, but for the most part, people consider themselves, hey, I've got really bad headaches. If therefore, you definitely have migraines, and that's kind of the way it goes. So they are kind of interchangeable, and there are certain migraines that and I'm not really going to go into all the different types of migraines for today, but you just have to think about bad headaches, be it a migraine or a tension headache or a subluxation based headache, will respond favorably to chiropractic most of the times. Now, all the times, no, but sometimes you have, I'll be honest with you, if someone comes in with a long history of headaches, one of the first things I want to do is get an MRI of the brain, because certain conditions are not going to respond to chiropractic, and could actually be made worse with chiropractic care if it's not done, if it's not done properly. So you really want to see what's going on, if there's an underlying condition or pathology that puts it out of the realm of a chiropractic process to heal. We want to get that up front. So a lot of times it'll ask for the MRI really before we really get started with care. X-rays will help show too. When I take an X-ray, I look to see if there's a good cervical curve. From the side view, you want to make sure there is a curve. A curve represents mechanical stability. You have a curve from the side in your lower back, and you have the same orientation of a curve in your neck area. So we really want those things to be balanced out and because the weight of the vertebra in the body, the actual skeleton, is supported on posterior elements, the facet joints, and that makes it really a lot easier for the body to work more efficiently. So when you lose the curve, you can lose the curve from, you can fall off a tree, you can have let's deal with the neck. You could have a whiplash accident. You could have a soccer injury, a concussion. A lot of different ways for the bones to go out of place. And basically, if they're out of place, you're operating at a mechanical disadvantage. But what I want you to think about is the mechanical disadvantage as it affects your brain and spinal cord. Okay, that's really the key part here, is how does that affect it? And usually it's pretty negative. I mean, do you want pressure on your brainstem? I don't think you do. But if you take the pressure off the brainstem, it could be a lot more effective than taking heavy duty medications. Um, Most of those medications, if you really listen to what they're saying, is that very, very limited in the scope of what they can help, and besides the toxicity of having to take a medication. So the thing with chiropractic is, if you're looking for natural headache relief, you found it. I mean, you really did find it. I mean, it's one of the most rewarding things as a chiropractor for me to treat our headaches, because people come in and really start to feel better when you get rid of the headaches. And it's a quality of life issue. I mean, because not only are they sleeping better, because they will, hands down, patients will sleep better if they have neck issues. And there are also some like basic neck exercises to do to enhance the work and kind of get that curve to restore, because it really is important to restore the curve if the curve is lost and the person is suffering from headaches, bad headaches, migraines, cervicogenic headaches. So the idea here is, well, first of all, it's not that complicated to fix. Most chiropractors can handle headaches pretty darn well. And the results should be seen within a 3 to 4 week period where the headaches are completely under control. Now, if they're not, then that's where you really do need extra imaging or a little bit more workup. Unfortunately, not all headaches will respond to chiropractic care. And the other thing too is, I mean, people are afraid of chiropractic 4, is always going to cause a stroke. The chances of you having a stroke are very, very minor, but it should be addressed because people are concerned about it. I mean, you have a greater chance of having a stroke getting your hair cleaned, getting a shampoo at the salon. I mean, the people who are at greatest risk are females in their 40s, on birth control and smoke. Those are your really at-risk people for, and you don't do risky maneuvers. I mean, you can do chiropractic can be a very, in my realm, chiropractic care has to be safe, chiropractic care has to be comfortable, and chiropractic care has to be effective. And when we hit all of those three targets, we're going to have a happy patient. And the idea is really to stick within those safe, comfortable, effective realm, because it really does the patient the most amount of good. And if you're suffering from headaches, I really invite you. And the fact that you listen to this podcast doesn't mean that you can come see me, because you could be in Oklahoma. But I'm more than happy to refer you to somebody if you reach out to me. My number is 203-656-3636, 203-656-3636. And you're more than happy. Reach out, and I'm more than happy to look up somebody in your area. I may have went to school with somebody, or different association, have a contact, but give it a try, because the quality of life will only improve. I mean, not having to rely on medications. That's a big thing. I mean, people just assume they have to be on medication to be healthy, and if you think about it, if you're taking medication, you really can't be healthy. So, chiropractic affords people with headaches, bad headaches, migraines, cervicogenic, neck pain, headaches, the opportunity to get their lives back. And that's a really big, big thing, because when you have to sit in a room, dark room, and all these different things, when I've had so many tough cases over the years, and that's actually the most fun I have in practice is helping people with headaches. Back pain, I'm pretty darn good at, and it's kind of more run of the mill. But if you're having headaches, I want you to strongly consider it. And if you're in my calling area, which is Fairfield County, you're more than welcome to come in for a consultation. I'm not going to charge you for a consultation. It's a chance to talk and to go over and see if it's something that we could pursue and fix. I'm more than happy to do that. But headaches are something that can be treated, and I look forward to helping you with your headaches. And if you have any questions, reach out, 203-656-3636, 203-656-3636. Dr. Brian McKay, Core Health in Darien. Really look forward to helping you get over your headaches, and fire away with any questions. Listen, have a great day. Thank you.